Save Unit 1, Introduction, Anatomy, and Cumulative Trauma. Let's listen to Phil, a journeyman mason who injured his back while lifting grout, a usual part of his job.
Something really very simple. Yeah, something I did a 1,000 times, and it's just that time. And then when I got home that night, you know, the whole left side of my body, leg, was just on fire. That is my vertebrae, and those are 2 screws. They are probably, I asked him how big they were, and he says they're as big as they look, so they're probably about that long.
How do you keep this type of injury from happening to you? These SAVE units will introduce you to ergonomics and safety voice topics. Using this combined knowledge is the best way to become a safety leader in ergonomics and prevent injuries at work. The goals of this ergonomics training are to provide you with materials that will reduce your chances of an on-the-job injury to your muscles, ligaments, joints, and discs. Teach you how ergonomics can help prevent injuries. And help you recognize and use ergonomic solutions specific to masonry. This training will also provide you with safety leadership skills to solve ergonomic and other safety problems, reduce hazards and injuries, increase morale and teamwork, and to improve productivity and work quality. First, we are going to focus on ergonomics principles. Ergonomics is defined as the interaction between you, the worker, your job, and your work environment. It's also called the ergonomics triad. Some people think ergonomics is only about stretching and lifting properly, but it's much more. Key point: ergonomics is using appropriate tools, equipment, materials, and work practice solutions to help prevent injuries. Ergonomics is important because injuries to muscles, ligaments, joints, and discs are common among construction workers and can end your career. Did you know that masons have a higher rate of back injuries than other construction trade workers? These back injuries can be caused by repetitive bending and twisting, something that masons do more than other construction trade workers. And this isn't just older masons. Construction workers under 35 years old have about as many back injuries as those older than 35. Key point: practicing good ergonomics keeps you safe and working your entire career. In these ergonomics units, you will first learn about anatomy so that you can better understand what gets injured. And you'll learn about types of injuries that can end your career, called cumulative trauma. We'll present the risk factors that lead to these injuries, including heavy lifting, awkward postures, and repetitive and prolonged activities. Then you'll learn about solutions to keep you safe and minimize the wear and tear on your body. Let's begin with anatomy. As an apprentice, you learn about the structural characteristics of brick and block. Likewise, to understand how to prevent injuries to soft tissues like your ligaments, muscles, and discs, it's important to know the structural characteristics of your body. This is anatomy. First, let's talk about your back. Your backbone is called the spine. The bones of the spine are called vertebrae. Right now, feel the bones behind your neck. You're pressing on part of the vertebra. The spine balances on top of the pelvic bones, which are also where the leg bones attach to the hip joints. Ligaments connect one bone to another bone. Ligaments hold you together and allow you to move, but they also limit motion to prevent too much wear and tear to your joints. Ligaments provide structural stability to joints, much like clips hold brick to a wall, while muscles provide stability to your entire body and create movement. If you didn't have muscles to secure and move your bones, you'd fall over. Muscles lengthen and shorten to move your bones around your joints. Muscles are attached to bones by tendons at each end of the muscle. Muscles allow you to lift, push, pull, kick, bend, and all other movements, as well as stand still. There are several layers of muscles along the spine and throughout the trunk. Large muscles provide the power you need to lift CMU, and the smaller muscles close to the spine keep your spine secure and maintain your posture. Let's see how much you know about common work injuries. What do you call injuries to your muscles, ligaments, and tendons? Record your answers in your workbook. An injury to a muscle is called a strain. An example is a strained or pulled back muscle. An injury to a ligament is called a sprain. An example is turning your ankle or knee. A tendon injury is called tendinitis. An example is tendinitis in the front of your shoulder or the outside of your elbow, frequently called tennis elbow. Between every two vertebrae there are discs. The disc has jelly-like material on the inside. The outside of the disc has strong fibrous bands. These fibrous bands are kind of like the belts in a radial tire. They help to keep the disc strong and hold the jelly in, just like the radial belts add strength to a tire. Now let's talk about the shoulder. The shoulder has the most movement of any joint, so it needs tough ligaments to hold the bones together. Over those ligaments are many muscles that provide strength, stability, and allow movement when you lift and place brick and block. The most important shoulder muscles are called the rotator cuff muscles. They control shoulder movement to keep the shoulder joint sturdy and stable. There is a tunnel in the shoulder. A rotator cuff tendon goes through this tunnel and can be pinched. This is why this part of the shoulder is called the pinch zone. The wrist is another important joint for masons to know about. Like the spine and shoulder, the wrist has bones. These 8 bones are called carpals. The bones are held together by ligaments. There are important nerves that allow the hand to function. One of these nerves runs through a tunnel created by the carpal bones and into the hand. The wrist also has muscles that move the hand. Most of the wrist muscles are closer to the elbow, with long tendons that run down the forearm. Now that you know something about anatomy, let's talk more about kinds of injuries. Have you heard the term cumulative trauma? What do you think it means? Just like there are different ways to get a flat tire, there are different ways you can injure yourself. You could hurt yourself in a single accident called an acute trauma injury. This would be like running over a nail. Even if your tires are brand new, they would be damaged. More commonly, injuries occur slowly over time, which is called cumulative trauma injury. This would be like driving too long on the same set of tires that become worn. In both cases, the same disaster strikes. Acute trauma happens immediately, like spraining an ankle while hiking, or getting hurt during a workplace accident, such as a fall. Cumulative trauma seems invisible because the damage builds up over time and occurs from repetitively doing the same thing over and over. Now let's simulate cumulative trauma. Just like the wire eventually breaks with enough bending, All materials, whether concrete block or human muscles, ligaments, or discs, have structural limits and can eventually break. It may take months or even years for the damage to your muscles, ligaments, joints, and discs to be severe enough to turn into a painful injury. Chronic overuse causes many small microscopic tears to form in our tissues. These tears heal with small scars throughout the tissues. Over time, we get more and more of these scars, and the tissues lose their stretchiness, also called elasticity. Because tissues with scars can't fully lengthen and shorten, they make your muscles weaker. When muscles aren't working optimally, you're more likely to have fatigue, pain, and eventually a cumulative trauma injury. The cycle continues over time, and you may get to a place where even a simple task, like bending to tie your shoes before heading to the store, can cause back pain, or depending on the activity, pain in your shoulders, neck, or other areas. Can you remember ever getting back pain when you did something minor, like picking up something small on the floor? This might have been the result of cumulative trauma. Acute and cumulative trauma back strains and sprains can be mild and heal on their own in a few days or weeks. However, it's common with cumulative trauma that these injuries become frequent and chronic, lasting months or more. That makes them difficult to heal. Can you think of a time when you had a muscle or joint pain that lasted more than a week? More serious cumulative trauma back injuries occur to the discs in your spine. If you constantly bend forward at work, and especially when you bend and twist, you may tear some of the outer fibers in your low back discs. Eventually, some of the jelly-like center of the disc is pushed backward onto the nerves, just like squeezing a jelly donut. When the disc is pushed far enough backward to cause pain, we sometimes call it a slipped disc, though the correct medical terms are disc protrusion, or, if more severe, a disc herniation. When this happens, it may cause severe pain and numbness in the sciatic nerve that runs down the back of your leg. If you experience this type of pain, go see your healthcare provider. These injuries can be disabling and cause you to miss many days of work. Neck and upper back muscles can also be damaged from cumulative overuse. We frequently call a muscle strain in our neck a stiff neck. Also, when the muscles in the neck become very short and tight, they can cause muscle tension headaches. And just like the low back, we can injure or herniate the discs in our neck. This results in severe pain and numbness into the arm and hand, making it difficult to handle masonry materials and tools. The wrist has a tunnel made of carpal bones and a ligament. A nerve runs through this tunnel. With overuse, such as frequent bending of the wrist or work in awkward wrist postures, the tunnel becomes inflamed and the nerve becomes irritated. This can cause pain and numbness in the hand, called carpal tunnel syndrome. It's often disabling and can result in time loss from while it heals or from surgery. Even after surgery, symptoms frequently come back. Can you think of a coworker who has had hand numbness or carpal tunnel syndrome? Have you ever had numbness in your fingers or hands? Try this activity to simulate numbness in your fingers. Think of how this could impact your ability to work. Finally, let's talk about the most common shoulder injury you could get as a mason, a rotator cuff injury. We've mentioned that there are 4 key shoulder muscles that form the rotator cuff. They're frequently injured from cumulative overuse and working in awkward postures. Rotator cuff injuries are painful and can require surgery to repair. This means time loss and sometimes leads to longer-term problems in the shoulder region that can affect your career. We've all had back pain and injuries, but disc injuries are pretty serious. Which one of these could cause injury to the discs in your lower back? The correct answer is D, all of the above. Most of us know someone who has an acute disc injury from lifting a heavy weight, but sitting all day or working in stoop postures tear the disc over time, allowing it to bulge onto the spinal nerves. What do you think are the activities in your job that cause cumulative trauma? Cumulative trauma is caused by wear and tear over time. It is sneaky and can take months or even years before you begin to have pain, and even longer until the damage leads to an actual injury. Like a tire wearing, the repeated wear and tear to your muscles, ligaments, tendons, and discs creates internal damage, making them less stretchy and strong and more prone to frequent pain and eventual injury. Remember Phil? His low back injury was caused by cumulative damage over time that resulted in a low back disc protrusion that happened one day when he was doing usual work activities loading grout. Your knowledge about ergonomics, anatomy, and cumulative trauma injury will help you spot job tasks that are risky. Later units will explore specific risk factors that lead to these injuries and solutions to help you reduce your chances of developing a serious injury.